Are you constantly tired, struggling with brain fog, or feeling like your body just isn't working? The truth is, your body may just be screaming for nutrients. I know a lot of people think detox, detox, but really your body may just be depleted. So I'm going to break down in this video how to tell if you're depleted using a depleted protocol. So you can identify exactly what your body is missing and potentially how to fix it. So over 92% of people have at least one nutrient deficiency, whether it's magnesium or it's an omega. Those are often common according to the CDC. And nutrient deficiencies are often linked to fatigue, anxiety, poor digestion, hormonal imbalances, and even chronic diseases. Yet most doctors don't test for them, according to Harvard School of Public Health. And so if you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school, so you don't have to. And today we are going to dive into a depleted protocol, a powerful way to assess for nutrient gaps in your body and take action before either any major health condition happens. If you are in my Intro to Holistic Medicine class, this is week 8. If you want to be, it is a self-paced course. You can register anytime by going to the link in my bio, scrolling down and filling out the form, and you'll receive some emails. So from there, we really want to also look at that nutritional assessment questionnaire that you did probably in week, I think it was 3, right? And so there was a questionnaire that you did assessing all of your nutrient deficiencies based off of all of your symptoms. So that is a subjective way that we use. Plus, you're using your pH strips. So you're testing your pH, you're looking at that, and you're looking at your heart rate. So that's definitely going to guide your understanding of where you may be depleted at. So look at that when we're working at. So first off, what is the depleted protocol? So it's a structural framework to identify common nutrient deficiencies based off of your symptoms. So each letter of depleted represents a different category of key nutrients your body may need. So let's go ahead and check it out. So let's break down what depleted really means. So D stands for digestion, which is detoxification and digestion. Woo, mouthful. Right. So key nutrients include B vitamins, zinc, glutathione, fiber, also your antioxidants, vitamin C, those sorts of things all can help with digestion as well as detoxification. Also, amino acids will help that liver work as well. Symptoms may be bloating, sluggish metabolism, or even frequent illness. So E in depleted stands for essential fats and fat-soluble vitamins. So vitamin A, D, K, and your omegas. I like to get my vitamin D from the sun, especially if my skin is not feeling great, but you can also use vitamin E topically. Vitamin A is found in carrot juice. Vitamin K is found in a lot of your leafy green veggies. And so dry skin, joint pain, poor immune function, and even depression are some of the symptoms of those deficiencies. Protein, I talk about protein all the time. Protein and amino acids, those key building blocks. So essential amino acids, collagen, and even glutamine can really help prevent muscle loss, brittle nails, slow healing, and hair thinning. L stands for liver and methylation support. So if your liver needs that additional methylated B support or choline or even sulfur compounds, vitamin C, also glutathione to help that detoxification process along, and magnesium, because some of the deficiencies may be brain fog, poor detoxification, or hormonal imbalances. Also, E stands for electrolytes and minerals, also another favorite of mine as well. Good coconut water can really help with those electrolytes and minerals. Key nutrients of magnesium, potassium, sodium, and calcium. And symptoms of deficiency include fatigue, dizziness, muscle cramps, and even heart palpitations. T stands for thyroid and metabolic function. Key nutrients for your thyroid and metabolic function is iodine, selenium, iron, and even tyrosine, which can also help with your mood. Symptoms of deficiency include cold hands and feet, weight gain, slowing metabolism, and hair thinning as well. E stands for energy and mitochondrial. People love that, especially when you're working out. Key nutrients include CoQ10, B complexes, carnitine for real fat burning, magnesium as well, really helpful, and minerals I would definitely fit in this category. Symptoms of deficiency would be chronic fatigue, brain fog, and a low endurance. D stands for digestion and gut health. Key nutrients are your prebiotics, your fibers, your probiotics, and of course your digestive enzymes. All can help with that, as well as hydrochloric acid, apple cider vinegar to help with your upper GI. Symptoms of deficiency could be bloating, irregular bowel movements, or reactions to different foods. So how do you identify what is missing? So symptom tracking, naturally writing things down, taking your nutritional assessment questionnaire, and then naturally you can also get into functional lab testing tests like organic acids or RBC mag. Those can definitely have deeper insights. Diet assessment too can also help if you know that you're not getting your key nutrients. I often will put patients initially on a strong multivitamin just because I already know that they have deficiencies. But then there's also symptom based. So if I know that, or if you know that you have a patient that's cold or gaining weight or losing their hair, they again may dismiss it as not a big deal, or I'm just getting older or whatever, but it could mean low iron, selenium, or iodine. And so we definitely want to test for those things so that a person knows those deficiencies and can improve them. So speaking of improving them, how do we correct these deficiencies naturally? So food first approach, I'm big on food. Supplement is just that, it's to supplement, not to replace. So food first, prioritize whole, nutrient dense foods that, are, healthy, grown, etc., organic whenever possible. And then you're going to use your smart supplementation. So once you get your diet to about 80% healthy, that's when you can start supplementing, adding more bioavailable forms of vitamins and minerals. I recommend patients start with food grade first and then kind of build more into professional grade just as their bodies start to, heal. The reason for that is because it's safer for the patient without lab testing. When you're getting into professional grade products, it's important to understand what dosings that you need to do so you can also have effective treatment. Also, too, we want to work on your lifestyle. So a holistic lifestyle is not just about taking supplements. It's about what you're doing in terms of mentally, emotionally, spiritually. Are you drinking enough water? How's your stress? Are you working out? All of these things really make a difference, because instead of just taking some random pill, someone that has, let's say, low iron can also check their gut health for absorption issues, but also eat a lot of heme-rich foods. So again, they're going to eat more of their green leafy vegetables, their kales, their chlorophyll, their spirulina, their sea moss, a lot of their minerals so that their blood can begin to build, right? They may also pair that with some vitamin C as well to really help with that uptake of iron, and maybe they'll do a low dose iron. So it just really depends. I find that iron is really harsh on my kidneys and really harsh on my bowels specifically. So I often will do a lot of things to build iron, build blood building without having to take a lot of iron. And I've done that for a long time. So most people don't realize that they're running empty, right? Until disease actually shows up. And then they crash land after they've been ignoring. And then all of a sudden they want a miracle. Well, depleted, we went through all of those different symptoms. And of course, if you filled out a nutritional assessment questionnaire, all of those symptoms are related to nutrient deficiencies. And it was like 4 pages back to back of symptoms. So if you want to do that survey, definitely join the class Intro to Holistic Medicine. It's all in part of that. And you'll follow along in the process, because we don't want to just jump in and jump out. Again, all this week is about being proactive instead of reactive. We're not doing drive-bys for supplements. So we want to actually check out if we are truly depleted so we can start to identify our body's warning signs early and take actions early to restore balance. If you found that this video was helpful, hit like, subscribe, and let me know in the comments what area of your health are you most depleted on and what do you want to work on the most. So see you in the next one.